Let's be real for a second. Every September, you probably get this thick envelope from your insurance company, and the first thought is, oh great, more junk mail. But if you're on Medicare or even ACA or Obamacare plan, that envelope called the Annual Notice of Change, or called ANOC, is one of the most important piece of mail you will going to get all this year. My name is Min Park. I'm an independent broker licensed in 15 states, and on this channel, Haksen, I try to take all the jargon, all the stress, and all the confusion out of insurance so you can make smart decisions. Today, we are going to talk about what an ANOC is and why you should never ignore it. So let's just start with the basics. The ANOC, the Annual Notice of Changes, is a document your plan requires to send you by every fall. If you are in the Medicare Advantage plan or a Part D, like a David drug plan, you should get it by September 30th. Inside it spells out exactly what's changing in your plan for the next year. Your premium, your deductible, your copay, your drug formulary list, and your doctors and pharmacy networks. The timing isn't random. Medicare's annual enrollment period, AEP, runs from October 15th through December 7th. The idea is you get your ANOC first, so you have a couple weeks to look it over and decide if you want to stay or shop. Here's how I tell clients to skim it. Start with the front page. This is your quick snapshot. Premium, deductible, copays, and a short list of what's changing. Next, go to the section on the benefits and the cost. See if your out-of-pocket maximum or specialist copays are changing. Then, look at the formulary section. Did your drug move to higher tiers? Did a generic suddenly become brand name? That is something that you definitely need to look over. Check the network list. Is your doctor or your specialist, your pharmacist still covered? I know it's not fun reading, but it's critical. Think of it like a patch note for your insurance plan. Same plan name, new rules. Okay, now let's talk about what's changing in 2026. Because this year is different. The big one is the prescription drug coverage. Premiums are expected to rise, and some Part D plans could go up by as much as $50 a month. Why? Because of the new $2,000 max out-of-pocket expenses cap in 2025. Last year, insurance companies were only estimate how much it would cost them. Now, they've seen the real number, and for many carriers, it costs a lot more than they expected. So in 2026, they are raising premiums to balance it out. Who affects the most? If you are only on one or two genetic medication, you may not feel it too much. But if you are on brand name or specialty drugs, this is where it really matters. Watch out for two things. Deductible going up. You may have to pay more before coverage even kicks in. And you are expecting to have higher max out of pocket as well. And also look out for formulary changes. A drug that was genetic this year might be reclassified as a brand name next year, which means you will suddenly pay more deductible for it. So even if your health hasn't changed, your cost can change. And that's why you need to check that ANOC letter carefully. Now, some of you are probably thinking, all right, Paksen, that's just for Part D people. I'm on Medicare Advantage, so I don't have to worry, right? Not so fast. In 2026, many carriers are already trimming their PPO options and raising premiums on Advantage plans. Some plans might even disappear. Here's the good news. Your ANOC will tell you exactly how much your premium will change and what's happening to your formulary if you stay in the same plan. That's why it is important to read it, even though, yes, it's boring. Now, I know some of you, what I call my early bird clients, you're eager to call me right now and say, Min, let's look at next year's plan. I love the energy, but here's the reality. By law, I cannot discuss new plan details with you until October 1st. That's a CMS compliance rule. Before even I show you a plan comparison, you will need to sign the scope of appointment form. That's just Medicare way to making sure the process is transparent. So what can you do now? Read your ANOC. circle anything that looks off, like a premium, copay, medications, then call me and book your spot. I will put my calendar link above. You can go to paksem.net/free, or you can call me and then make an appointment. So when October 1st hits, then we can talk about your plans. So click it and make an appointment with me. Now, let me tell you something most clients don't know. 2026, more carriers are moving their Part D and some Advantage plan to non-commissionable status. That means if I help you sign up for one of those plans, I don't get paid. Here's why that matters. Checking a Part D plan isn't simple. I have to look up every single medication, the dosage, and the pharmacy, then calculate costs across different plans. That can take a lot of time. And if a plan doesn't pay commission, many brokers won't bother. That's why some people never hear from their agent even if their plan changes. Or the worst, they called and don't get called back because helping with a non-commissionable plan doesn't put food on the table. I want to be clear. I am not here to shame other agents. This is just a reality of the industry. For me, I'm solving it a little differently. If you live in one of those 15 states where I'm licensed, I am giving you access to my professional Medicare comparison tool for free. I will put link above, or you can simply type in paksem.net/Medicare_self. You will be able to plug in your prescriptions and see your options yourself for free. I will even make a tutorial video on this channel showing you exactly how to use it. That will be later in the September. So make sure you subscribe so you won't miss the notification. That way, you get the information that you need and I can save time so I can help more people. For people outside of my licensed state, I wish I could help you directly, but licensing takes time, money, and ongoing training. My plan is to add states each year, but I am not everywhere yet. So here's what you can do. Go to Medicare.gov, create the login, enter your prescriptions, and you will see estimated costs and available Part D and Advantage plan in your area. It won't tell you which plan is the best fit for your lifestyle, but at least you will know what's out there. And if you take that information to a local broker, you'll be in a stronger position. You will ask better questions and you have a better conversation instead of going in blind. All right. Let's lock in dates so you don't miss them. September 2025, ANOC will going to mail it out. Review it as soon as it lands. October 1st, 2025, you can talk with your agents and broker about 2026 options. Now, October 15, 2025, annual enrollment period begins. November 2025 is going to be a sweet spot for shopping and talk with the agents. December 7, 2025, will be deadline. After midnight, you are locked in. And January 1st, 2026, yes, new coverage will start. Put those in your phone, write them on your fridge, whatever works. Medicare doesn't play with those deadlines. Now, you might be thinking, okay, Paksem, that's just a Medicare. I'm on Obamacare/ACA plan, and it doesn't matter to me. Well, it does. Here's the big one. Aetna is pulling out of ACA Marketplace nationwide in 2026. That includes Banner Aetna and CVS Aetna plans that built good benefit with a low premium this year, and financially it didn't work for them. Instead of raising rates like sky high, they decided to exit completely. If you're on one of those plans, you should be already gotten a notice. Do not assume your plan will auto-renew. If you do nothing, you could wake up in January 1st with a no coverage. It's not just Aetna though. Carriers are raising premiums, shrinking networks, and changing benefits in 2026. So if you have chronic condition, you may be stuck paying higher premium. If you are young and healthy, you might start looking at alternatives. Either way, the lesson is the same. Don't assume nothing will change. One last Medicare point, and this is the big one, and it's very important. Sometimes you will get a letter saying your Advantage or Medigap plan is ending or exiting, and your first reaction would be, This is awful. I love my plan. Now it's gone. But here's the silver lining. If your plan is discontinued and you got special enrollment period with the guarantee issue rights, that means you can move into Medigap supplement plan without medical underwriting, no health question asked. For someone with a chronic condition who's been stuck in an Advantage plan, this can be life-changing. For example, if you are hitting, let's say, max out-of-pocket expense plan for $5,000 every year, switching to Medigap could mean paying higher premium, but almost no out-of-pocket expenses after that. Inexpensive agent might waste their SCP by just putting you into another Advantage plan. But an experienced broker knows this could be your one shot at the Medigap plan that truly protects you. So don't throw away your ANOC thinking it's junk. For some of you, it could be your golden ticket. So here's the bottom line. 2026 is not business as usual. Medicare is changing, ACA/Obamacare is changing, premiums are rising, networks are shrinking, plans are disappearing. So if you are in one of my licensed states, let's talk. Book a time now so you are ready when October 1st hits. If you are not, use Medicare.gov and connect with the local broker. But whatever you do, don't do nothing. Because doing nothing this year could leave you paying a lot more. Or the worst case, without coverage at all. I'm Min Park, or you can call me Park Sam. Thank you for watching and make sure you subscribe so you don't miss my step-by-step tutorial on the using Medicare comparison tool. That video could save you hours and a lot of money. See you next time.